A very big hello to dear students and all friends, and I welcome you to the next video of this series of clinical examination of swellings. So far in the section of palpation, we have seen various features like temperature, tenderness, surface, margin and consistency of any swelling. Now let's move ahead to one of the most interesting features of palpation of a swelling, that is fluctuation. Well, in a most straightforward way, I can say that a positive fluctuation means there is presence of some fluid inside the swelling. Now in terms of physics, anything which can flow will be a fluid, and liquid and gas both are fluids. But practically, gas is present in our body mainly in the lungs and bowels. So most of the fluctuant swellings which we routinely get, they contain some kind of liquid, and here are some examples. If the swelling contains any of these fluids, it will give rise to a positive fluctuation test. And some common examples are liquefied hematoma, cystic hygroma, abscess, ranula, etc. I must also add CSF in this list, which is present in meningocele and encephalocele. Now in clinical examination, the fluctuation test is based on the principles of Pascal's law, which states that the pressure exerted to a fluid is transmitted equally in all the directions. So in this case, if these two fingers, they generate a pressure wave at one pole of the swelling, and if there is fluid inside the swelling, then the wave will be transmitted to the other pole and it will be felt by these two fingers. So these fingers, they are called as displacing fingers, while these two who feel the wave, they are called as watching fingers or feeling fingers. Now here I would suggest you that before examining this on any patient, you should try to feel this wave on some non-living object. You can use a water-filled balloon or a pouch of milk or mineral water for it. If you hold a balloon or a pouch of mineral water at one pole and generate sudden sharp wave, then you will feel the wave at the other pole by other fingers. But remember that you don't have to press these fingers deeply, but instead of it, you have to make sudden sharp movements to generate pressure waves. Now in contrast, if your swelling is not having any fluid inside, then the pressure waves will not be transmitted and the watching fingers will not feel anything. So in this case, the fluctuation test will be called as negative. Now here again you can do the same experiment using a soft cotton ball or a smiley ball. They'll feel soft like the water balloon, but here the fluctuation test will be negative. Now during clinical examination, there is no single method to assess fluctuation of all swellings. Everything depends on size and mobility of the swelling. We'll see all the tests one by one. Now here, as you can see that depending on the size of the swelling, you can use 2 fingers, 4 fingers or all fingers of your both hands. Now in all these cases, one set of fingers, it is displacing finger, which is generating the pressure wave, and the other set is watching fingers, which are passively feeling at the other pole. Fluctuation test cannot be performed on a mobile swelling, so it is quite essential to first fix it. Now as you can see here, thumb and index finger of one hand is fixing this mobile swelling, and index finger of other hand, it is generating the pressure wave on the pole. Now in this case, these two fingers are doing a double job because they are not only fixing this mobile swelling, but at the same time they are simultaneously feeling the pressure wave. Now interestingly, if your mobile swelling is quite small to accommodate this third finger, then you can replace it by some non-living object like pen or even a matchstick. Because the pressure wave can be generated by pressing the swelling by these objects also. And you have to keep your watching fingers steadily over here, and full concentration should be on perception of pressure waves. Now if the swelling is so small that it can accommodate only one finger, then in such cases, Paget's test can be performed. Now in this test, no pressure wave is generated, but the swelling is pressed in its center and then in its periphery to assess the difference in consistency. A cystic swelling means which contains fluid, it will feel softer in center than in periphery. While opposite to it, if your swelling is solid, then it will feel firmer in center and will be softer in periphery. But this test should be performed only in cases of very small swellings which are unable to accommodate even your second finger. If your swelling is in the vicinity of a muscle, say for example in the limbs, then you should make a habit of testing the fluctuation test in both horizontal and vertical planes. Because sometimes a fleshy muscle may give rise to positive fluctuation test in a direction perpendicular to the direction of its fibers, but not along the direction of its fibers. So if you are getting a positive fluctuation test in this plane, then it can be because of swelling or because of muscle also. But a positive test in this plane is only because of the fluctuation generated by the swelling. So to avoid the confusion created by the fluctuation of the muscle, the test should be done in both the planes. Now let us see some interesting examples of false positive fluctuation test. That means there is no fluid inside the swelling, but still the test is positive. This can happen in case of very soft tumors like lipoma and myxoma, because our fat at body temperature behaves like a fluid, and that is why this type of fluctuation test is called as pseudo fluctuation. So in case of a pure lipoma, you will feel a positive fluctuation test, but there is no fluid inside. And if you will aspirate by a syringe and needle, there will be a dry tap. Now opposite to it are the conditions where the test is false negative. That means the fluid is present inside the swelling, but fluctuation test is negative. There can be several reasons for it, like if fluid is thick or it is under great tension, then in such cases the pressure wave will not be transmitted properly and the test will be negative. Here I must remind you what I had said at the end of my last video, that consistency of a cyst is variable and it depends on these two factors, thickness and tension of the fluid. So a cyst can be soft or firm or even hard, and terms like cystic consistency should be better avoided. The other reason for false negative test is if the swelling is quite large. So in such cases, the wave will be generated, but it will not be able to reach properly to watching fingers. And lastly, if the wall of swelling is thick and calcified, then even if there is fluid inside the swelling, the test will be negative. Now let's say a few words about the cross fluctuation test. Now it's same as the fluctuation test, but here there are two swellings across some anatomical barrier, and the secret is that both of these swellings are connected to each other. Here are some examples like compound palmar ganglion, plunging ranula and iliopsoas abscess. Now let's take the example of compound palmar ganglion. In this case, there are two swellings, one in the palm and other near the wrist joint. They contain fluid and externally they look as two separate swellings. But the secret is that internally they are connected to each other. So by using the same principles, if you keep your displacing finger here to generate a pressure wave, it will be felt by the watching finger capped on the other swelling. And in such case, the cross fluctuation set will be said to be positive, which is suggestive of some connection between these two swellings. And finally, I must conclude with a very famous statement, or rather a common mistake in presentation. Consistency is hard, fluctuation test is negative. I'm sure that every teacher or examiner has heard this statement and he has corrected his student for it. Because if you are feeling that consistency of your swelling is hard, then in that case, please do not even take the name of fluctuation test. Because as we had seen in the last video that a hard object cannot be pressed by external pressure, then in such cases, you cannot generate a pressure wave by your displacing fingers. In other words, you cannot perform a fluctuation test in a hard swelling. So in such cases, you should skip this test and should proceed for other tests of clinical examination. So that's all for this video. If you liked it, please share it with your friends and subscribe the channel. We'll meet again very soon with another video on some more features of palpation of swelling. Till then, stay healthy, stay safe, and always keep learning in your life. Goodbye.